Let's talk about tendinitis of the elbow, whether it be tennis elbow on the outside part, golfer's elbow on the inside part. The best way to treat tendinitis of the elbow is not to get tendinitis of the elbow in the first place. What do I mean by that? Well, how about let's start paying attention to the symptoms before you actually have full-blown pain symptoms in the elbow. So think about the anatomy. Usually the tendinitis is involved close to the elbow of the muscles that are found on the forearm that actually help move the wrist. Okay, the wrist and forearm and the hands. So start paying attention to when you start feeling soreness or just excessive muscle work of the muscles around your forearm, inside, outside part, okay? During whatever activity that you do repetitively. Now, most people that get tendinitis of the elbow are usually people who lift weights, who exercise a lot, and they do a lot of pressing and pulling type of motions. Over time, they start developing these. Also, people who are non-exercisers don't lift weights, but they're just very active. They do a lot of manual work, whether they're clinicians, massage therapists, chiropractors, therapists, or maybe they're chefs or cooks, or maybe somebody who just works with their hands a lot, such as people who sew, things of that nature. So these are repetitive strain injuries where they're repetitively doing the same patterns to get the job done or whatever they have to do, and to the point that it surpasses the threshold of the soft tissues and they start the inflammatory process and start having symptoms. So you want to be able to prevent that by stage one is to be aware of symptoms before the symptoms happen. What do I mean by that? Is if you're doing something and you start feeling the muscles around the elbow, the forearm are overworking, you want to change something. Of course, you could stop and rest, or you could just change your posturing or your positioning of all the structures involved of the soft tissues around the elbow. So for example, if you're weightlifting, whether you feel the symptoms, let's say during a bench press or during curls, whatever, be aware of two things essentially. One, position of your wrists, okay? Two, position of your elbow, which is going to tell you what rotation or what position your shoulder joint is placing your elbow in which you do a movement. So your elbow here, if it comes up like this or it comes down like this, that's really movement from the shoulder, okay? So if you're doing a bench press and the elbows are flared out a lot, like there, that can change, that can have a different area of pressure or stress than if your elbows were in and you're doing a bench press, okay? So everyone's a little bit different, but play around. And also with the wrists, let's say you're bench pressing and your wrists are extended like this too much, okay? Where you really want them to be more neutral like this. So that takes some strain off of that forearm and also the shoulder joint. But anyway, the best way to treat a tendinitis of the elbow is not to get the tendinitis in the first place. So be aware, pay attention to the symptoms before you even have symptoms. Think about it.